us today. My name is Dr. Wendy Pomerantz, and I'm a pediatric emergency medicine physician, past president of the Injury Free Coalition, and one of the founding partners of the National Injury Prevention Day. We started National Injury Prevention Day 4 years ago to raise awareness that injuries are the #1 killer of people in the United States from 1 to 44 years of age. Injury Free is a national coalition of physicians and other healthcare providers, community advocates, researchers, and many others that come together to prevent injuries to kids. It has always been our desire to bring everyone together to speak in one voice. We believe that working together, we benefit the fields of injury and violence prevention, and that in turn benefits each of our individual efforts. National Injury Prevention Day has blossomed and now includes more partners and more insight into this national problem. NIPD partners plan, carry out, and review the events that take place on National Injury Prevention Day. Each organization brings to the table expertise and membership that helps to execute the day's activities. Injury Free serves as the umbrella sponsoring organization overseeing and promoting the day's events, capturing them on the NIPD webpage and the Injury Free website, and tracking their completion. The day's activities include the following: this kickoff webinar, the Twitter/X chat, shining a green light, community programs and events, proclamations, internal staff education and outreach, social media and other campaigns, research programs and policies. There will be a lot of our partners speaking today, as well as some other featured speakers. They will be introducing themselves or the following speaker as they come. When we are done, we will have people take your questions. If you would enter them into the chat, that would be great. At the end, we're going to hear some closing remarks from Delaney Roca. So welcome to this 4th annual National Injury Prevention Day. Join us in this observation by shining a green light and learn about what's happening in your community as we work to raise awareness about the need to prevent injuries and deaths in people of all ages. Our first speaker today will be one of our partners, Richard Hamburg, the Executive Director of Safe States Alliance.
Thanks, Wendy, and honored to be the leadoff hitter leadoff batter in today's lineup of outstanding individuals. And I just wanted to kick things off and say how great it's been to see the growth of the commemoration of National Injury Prevention Day. The growth has certainly been geometric over the past couple of years. Our steering groups have been looking for ways to secure additional commitments and support from across the nation. And last year we initiated a sign-on letter that we thought would be a good way of securing commitments from organizations about the importance of the event and committing to doing whatever they can do to move things forward. So the letter itself, among other things, talks about raising awareness of injuries and acts of violence and so on, and it urges organizations that sign on to step up and be part of the change, to wear green, to shine a green light, to move forward toward change, and in general to join forces to promote National Injury Prevention Day. The letter was circulated last year. We were able to secure over 50 organizations signing on. This year, we updated it, sent it around, and thus far have been able to secure over 75 organizations. They're regional organizations, state organizations, hospitals, national organizations, and so on. We have a document we could share in the chat that has all of the logos for the organization. So it's kind of nice to see how difficult it is to shove 75 logos onto a single piece of paper, but it does show the importance and the breadth of support. And in closing, we were able to send it out as part of a press release yesterday. So we sent out a press release on behalf of there it is. If you could just move on down to the logos. Yeah, so two slides to get the logos on. So we sent it out via a press release on behalf of the organizations. And hopefully we'll get some good attention to it and opportunities to get some coverage. And then also we sent it out to all members of Congress. So it went to the health staff of all 535 members of Congress yesterday as well, with an ask to, to talk about how important this is, and if they want to get involved in any events going on back home to contact us. So those are just two ways that we were trying to promote the importance of National Injury Prevention Day. So all done, ready to move on to Dr. Barlow, I believe, whoever's next.
Hello, everyone. It will be Mackenzie Riley who will be introducing.
Wonderful. Welcome, everyone. My name is Mackenzie Riley, and I serve as the communications manager for the American Trauma Society. The ATS is certainly honored to partner with Injury Free Coalition for Kids for the 4th annual Injury Prevention Day. Our collaborative efforts are laser focused on reducing death and disability of our nation's youth and young adults from unintentional injuries. Along with all of you, we are dedicated to shining a green light today and every day in order to keep this at the very forefront of our minds, and to really remain on top of the epidemic of preventable trauma. As the home to the hospital-based injury and violence prevention professionals education and the Trauma Prevention Coalition, we stand with you, and it is certainly time for a change. Our mission here at the ATS is to save lives, improve care, and empower survivors. And today we advance that mission through our partnership with National Injury Prevention Day 2023. So thank you all so much for joining us. And I will go ahead and pass it on to Delaney Roca, the program manager for Columbia Center for Injury Science and Prevention.
Hello, everyone. I'm also the administrator for the Injury Free Coalition for Kids, and in addition to the administrator for the Injury Research Center. I'm so happy to see everyone here. There's so much more coming in terms of presentations, but I just wanted to thank our NIPD invaluable partners that have made this happen today. Over this weekend, we will come together to raise our voices and shine a green light on injuries and the need for injury prevention in America. And you all have not stopped and will continue to show and shine a green light. We have already, as of this morning, 300 NIPD submissions that are happening across the country. This is 120 shining of lights, over 100 community events, over 35 proclamations, and in internal education. And we also have a lot of social media going on. Please use the hashtag #BeInjuryFree so that you can communicate the work that you're doing, and so that we can show the great impact that we're having on this world, and potentially one day be able to definitely prevent injuries and educate everyone. Now I want to introduce Dr. Sam Posner, who is the acting and director of the National Center for Injury Prevention and Control, who will kick off this weekend of awareness.
Great. I believe you can now see my slides. Is that correct?
Yes.
I did it right. Well, good morning and welcome. I'm Sam Posner. I am the acting director for the National Center for Injury Prevention and Control at the CDC. And it's my great pleasure to be here. And it's really an honor to be part of this presentation today, this discussion today. Today, as you all know, we commemorate National Injury Prevention Day by coming together as a community to increase awareness, promote safety, and prevent injuries. Injuries can happen to anyone, anywhere, anytime, and they not only cause physical harm, but they can also cause and can result in emotional trauma and financial burdens. However, it is through education, preparedness, and collective action that we can create a safer environment for ourselves and our future generations. And CDC's Injury Center is dedicated to researching what works to prevent injuries and putting those findings into practice. Each year, CDC's Injury Center is one of the leading experts on protecting people, saving lives, and reducing costs from injury and violence. But we do this through partnership with you all. And each year, injuries and violence lead to 23 million emergency department visits, nearly 3 million hospitalizations, over 78,000 deaths, and $4.7 trillion in lifetime medical care costs and lost productivity. And our work really does address many causes that contribute to the numbers, these numbers, while placing special focus on 3 strategic priority areas. The first of which is adverse childhood experiences, or ACEs, overdose, and suicide. These public health crises are urgent, related, and preventable, and all require coordinated, collaborative approach for the greatest impact. And we can only have the greatest impact when we work in partnership with you all. The Injury Center is committed to preventing violence so that everyone can be safe and healthy. We are actively supporting 52 states and territories by collecting and linking data on violent deaths to better understand how to prevent them. We support 9 injury control research centers, including the one at Columbia, who is our host today, working on a variety of key topic areas. The Center for Injury Epidemiology and Prevention at Columbia is doing core research projects on transportation, suicide, ACEs, and opioid overdose. We've worked with the Injury Free Coalition for Kids on traumatic brain injury through the Heads Up program. And these are just a couple of examples of what's happening in the field. Our ICRCs, or the Injury Control Research Centers, the ICRCs as I will refer to them, are at the front line of studying ways to prevent injuries and violence, and taking what they learn and putting it into action, as well as training the next generation of researchers and public health professionals. In 2023, Congress increased the ICRC funding to $11 million. This led to a nearly $170,000 increase in funding for all 9 ICRCs. This kind of funding is really important to furthering the work that they do and bringing things to the communities to have an impact. And we encourage all of the ICRCs to work with other partners, and who represent underrepresented geographical areas, underserved populations at increased risk, to advance these violence prevention programs. There we go, the next slide. One of the key things at CDC that's really important is timely and accurate data. And the Injury Center relies on several unique data systems to inform policy and program, and really work to get that data quickly out to programs and to communities so they can take action. The first of which is the web-based injury statistics query and reporting system, which is a mouthful that we refer to as WSCARS, provides data on fatal and non-fatal injury, violent death, and related costs. The National Violent Death Reporting System is a state-based surveillance system that uses over 600 unique data elements related to who, when, and where, and how violent deaths, including homicides and suicides. And that data is very important to informing programs and prevention strategies. The State Unintentional Drug Overdose Reporting System, or SUDORS, is a dashboard that is interactive, and you can use that interactive tool for data visualization that displays comprehensive data on drug overdose deaths from 28 states and the District of Columbia. And finally, the Drug Overdose Surveillance and Epidemiology, or DOSE dashboard, is another interactive visualization tool that uses emergency department data using syndromic surveillance to better understand non-fatal drug overdose events. In addition, the data systems, in addition to those data systems, there are tools and resources that the Injury Center makes available to partners. And one of those is the Resources for Action. These are a set of documents that are designed to help states and communities take advantage of the best available evidence to prevent injury and violence. NCIPC currently funds all work in all 50 states, localities, tribes, territories to help make direct impact on communities. The Injury Center advances research and science to prevent injuries and violence and reduce their consequences. Using evidence-based research, the center translates this science into effective policies and programs and adapts those strategies to communities to address specific cultural needs and increase adoption and impact. And one of the things, nearly 95 or 85% of our budget is awarded to partners outside the federal government, including you all, states, localities, tribes, nonprofit organizations, and others. This is the only way that we can actually accomplish our mission to share a vision where a world is free from injury and violence. There are a few ways to do this are at the core of what we do. One is to lead with shared values. We're committed to centering our work around health equity. This is a fundamental part of our work. We define health equity as a state where everyone has fair and just opportunity to attain their highest level of health. And we recognize that the focused ongoing effort required to address injustice, overcome obstacles to health and health care, and eliminate preventable health disparities. The second area is really the aim for alignment between policy, funding, and programs. We do achieve greater impact where there is alignment that addresses policy, funding, and programming that work together rather than focusing on each one separately. And then third is really collaboratively, thinking collaboratively. Our center is committed to a coordinated approach with existing partners, cultivating new partners to address today's crises while working to prevent tomorrow's. I want to circle back to the health equity because I think this is so important. Really, I've been at the Injury Center a short amount of time, but I'm really compelled and believe very strongly that health equity is at the core of the work that we do. And really, that's one of the things that we need to focus on if we are going to have an impact and really realize the vision where people are free from injury and violence. As we look towards the future, the Injury Center is committed to cultivating a diverse workforce. And this is an inclusive workplace and where we work to advance health equity to prevent injury and violence in everybody, in every community. In 2022, we published our diversity, equity, belonging, inclusion, and accessibility, or as we fondly refer to it as the DEBIA strategic plan for our workplace and our programmatic scientific work. We also support the advancement of violence prevention through newly created programs. There are several that I want to highlight, one of which is the Advancing Violence Epidemiology in Real Time, or AVERT. The recipients of the 12 recipients of these awards will work to improve timeliness on surveillance data from emergency departments for firearm injuries, other violence-related injuries, and mental health conditions. AVERT builds on the previously funded firearm injury surveillance through emergency rooms, or FASTER initiative, by adding new work to conduct real-time surveillance of other violence-related injuries and mental health conditions beyond just firearms. In addition, in September, we awarded the Essentials, 12 recipients for the Essentials of Childhood, Preventing Adverse Childhood Experiences Through Data to Action. This program is really focused on strategies to prevent ACEs and promote positive childhood experiences. Building on the impacts and outcomes of the CDC's Overdose to Action program, and in an effort to reach more localities, CDC is funding 2 different overdose data to action activities. There's one in the States, and then the new one is really in the local communities. And this one will really focus on the most impacted communities who have been impacted the most by overdose and build an infrastructure for surveillance, harm reduction, recovery, and care. CDC will fund states as well in this program or through the state level program to collect high quality, comprehensive and timely data on non-fatal and fatal overdoses and use those data to really inform prevention and response efforts. And CDC's comprehensive suicide prevention program, for the CSP, funds 24 recipients, including 7 new recipients this past September, to implement and evaluate a comprehensive public health approach to suicide prevention with attention to populations that are disproportionately affected. And before we end today, and you can tell my voice is hoarse, but I have tested. I do not have COVID, but I do want to just take a moment to remind people that vaccines, it's important that we take all precautions we can to prevent injuries and violence, but also to prevent unnecessary illness by staying up to date on your vaccines, whether that's flu, COVID, or RSV. There are, the vaccines are available, there are treatments available, and there's testing available. And, we encourage, the CDC is encouraging everyone to get their vaccines to protect themselves and their loved ones. And, this is a critical part of the, sort of a core and comprehensive public approach to preventing disease, preventing injuries, and preventing violence and reducing the harms that those things cause. So I want to, in closing, just thank you very much. It's an honor to be here and to be a part of this. And I look forward to the rest of the presentations and your continued partnership and work. And now I'm supposed to introduce our next speaker, who is Taureen Kreppe from Safe Kids.
Thank you, Dr. Posner. An amazing presentation and lots of information we can all use as we move forward. I want to say thank you to everyone. I am excited about Injury Prevention Day. And I wanted to say to Dr. Pomerantz, as one of the founding members of this day, I don't know if you thought about it, but I think leading into the most busiest traveling day of the year, which is holiday travel for Thanksgiving, is a good way for the work that we're doing at Safe Kids to protect and prevent unintentional injuries to children at home, at play, at school, and on the way. And so for us, this past July, we launched our strategic plan, Equity and Child Safety. And I want to tell you, our goal is to continue to make an impact in communities that are historically marginalized and underserved. Most importantly, we want to provide materials in plain language. And so we have over nearly 30 coalitions that will be doing multiple events this weekend. They will be lighting up their community in different ways. And we're just honored and privileged to have Safe Kids Worldwide and Injury Free working together and really sharing the messaging that each and every one of you have done through research, programs, advocacy, and most importantly, our members on the ground implementing and making a great impact. So thank you. Have fun this weekend. Do it with a smile and with kindness. And I would now like to introduce my dear friend, Anna Acosta from El Paso.
Thank you, Taureen. Jamie?
Yep, I will take over first. My name is Jamie Troyer. I'm the Injury Prevention Outreach Coordinator for the University of Utah Health. Anna and I are both on the TCAA's Injury Prevention Committee. We wanted to talk to you guys today about our second year into our social media contest that we did. So a little bit of history on our social media contest. And I did want to share just so you guys can see what it looks like. So I'm going to do that just to kind of take some time and give us some things to look at. So looking at this, we did a national injury prevention media contest. Our focus was, again, to let's interact with our youth. Let's get them involved in what safety looks like. Let's reward them for being safe and being involved. And so we did this, again, the second year of our media contest. Our first year was on safe surroundings. This year, we decided to have them teach us about the evolution of safety. Why do we have safety implementations now? Like you look at this, a football helmet, what it looked like back in the day to what it looks like now. We had a lot of fun jokes about car seats and all that kind of stuff that came around this. So really excited. We shared this on social media. Each of our groups put this out in their community across the country. And happy to say that we went from very few submissions the first year to 91 submissions this year. We were really excited to see that involved and love to be able to highlight what our youth are doing and getting them involved in this media contest. So it is closed, and we're hoping again that you guys will join us. And I'm going to turn this over to, I'm going to put the next slide, Anna, to show some of our winners from last year and let Anna talk about this year.
Thank you, Jamie. Hello, everyone. I hope you're all excited to see all of our wonderful winners, and happy almost National Injury Prevention Day. We will be releasing each winner on the TCAA social media web pages tomorrow, beginning at 2 p.m. Eastern. So please make sure to check them out and let us know what you think. If you are not a social media person, of course, you can always check out the TCA website at traumacenters.org on Monday, and the winner should be there too. I do have to say that the students really pulled through this year and the submissions were outstanding. It was really hard to judge. But the good news is that this year, TCAA was able to provide students with volunteer and community service hours for their participation. So even if they didn't win, they still get recognition for the hard work that they put into it. It was a really nice addition. So hopefully more students will take advantage of it if we are allowed to continue this for the next year. So please make sure to check them out. You will not be disappointed, I promise. And with that, we would like to introduce Rita Adler, the Director of Operations for JPMA Cares.
Thank you, Anna, and good morning again, everyone. JPMA Cares is excited to be a partner of the Injury Free Coalition and National Injury Prevention Day now for many years. For those who don't know who we are, JPMA Cares creates better outcomes for infants and toddlers by reducing preventable injuries and deaths and providing families in need with donations of time, talent, and product. This year, in conjunction with manufacturers in the juvenile products industry and the Juvenile Products Manufacturers Association member companies, we were able to receive donations of 2,900 products valued at approximately $150,000 to be sent to injury-free sites around the country. I was on a call yesterday with many of these sites who mentioned how their offices now look like warehouses, and we love to hear that the products our manufacturers donated will go to great homes and help to educate those receiving those products on the proper and safe way to use them to keep their children and families safe each and every day. Thank you again for having us as a partner this year, and please help me in welcoming Dr. Kyron Quinlan, former principal investigator at Injury Free Chicago, and now pediatric medical advisor and the director of the Illinois Department of Public Health.
Thank you very much, Rita. I am thrilled to be here. This is such a great collection of people, and I just want to start, Delaney, thank you very much for organizing all this stuff. This is wonderful. I know it's a lot of work. And as I start, I just want to take 1 second and thank Dr. Barbara Barlow, who started this whole Injury-Free Coalition for Kids with her brilliant work to get outside of the hospital, figure out why her Harlem hospital was filled up with all these kids getting hit by cars and all these falling out of windows, getting outside of the hospital and doing something about it, finding that the kids had no off-street play places and building playgrounds so that they had places to play that were safe, finding ways to intervene and get the windows covered and have these safe bars put on there so that the kids aren't falling out of the windows, and then having the data to prove that the problem existed and the intervention was effective. It's just a brilliant model, and no doubt, no wonder why Robert Wood Johnson wanted to franchise it, and then it turned into this, the Injury-Free Coalition for Kids across the entire country. All of these level 1 trauma centers doing this type of work. It's just brilliant and wonderful. So it's a huge team effort of not just the Injury-Free Coalition for Kids, but Safe Kids Worldwide and everybody, all the groups represented here today. It's just a wonderful thing. You know, there's been so much progress over the years of, I've been doing this for a little while. You see my gray hair now. There's been a lot of progress. Motor vehicle injuries, you know, has just seen dramatic progress. Literally for the kids, it has never been safer to be in a car and travel on the roads of this country. There has been a huge drop in motor vehicle crash deaths for kids over the last about 10 years, literally almost in half. from what it was about 10 or maybe 15 years ago now. And that's a product of a ton of work, not the least of which is surveillance and understanding of ways we could do things to prevent. But, you know, there have been steps along the way with, you know, the information from analysis of data like Flora Winston and Dennis Durbin's work to understand the safety of booster seats and the promotion of booster seats, getting those kids in some protection when they were not before. So it's like little steps like that as we go along. Graduated driver's licensing, drinking and driving. There's a ton of, there's safer cars, safer roads, and kids are far safer than they ever were. We have huge challenges though, the other areas where we have not made similar progress. And in particular, I'd say violence is one, suicide and self-harm is another, and sudden unexpected infant death, which I'm so happy is being embraced as a form of injury. You know, a decent proportion of these are suffocation events, and that is an injury, and it is part of our world, and we need to work on it. 3,500 kids each year under the age of 1 die suddenly and unexpectedly in this country. 3,500. It's a huge number, and unfortunately has not really had much improvement in the last 20 years. You know, there's been great work. You know, it's really like getting out and finding ways to make things safer. I just want to, for 1 second, think about like scald burn prevention. You know, for little kids, they were being burned by their tap water. It's just too hot at the tap. And Dr. Ken Feldman in Seattle and Dr. Murray Katcher, both pediatricians. Murray Katcher is in Wisconsin, and they basically got out of the office, measured the temperature of tap water in their community, found that, you know, rather than telling families watch your kids better, the answer was change the setting on the hot water heater, make it so that it wasn't scalding hot, and then actually legislate that so that the default settings of hot water heaters are not crazy high and will burn kids. So I'll stop here. My basic point is we have got to keep working to find ways to get past the idea of telling everybody to supervise their kids a little better and blaming the families, but make the world a little safer for normally developing children. Kids are curious. They will go around, they will find the hazards in your home, and that is normal. They will find Santa's Christmas presents in the closet too. So make it so they can't. So when we put away guns, they have to be locked up. The ammo has to be locked up separately. We have got to make the world safer for kids. One last quick thing is, Dr. Posner, thank you so much for your work, and you're carrying the torch. And I have a connection to National Center for Injury Prevention Control. I did my Epidemic Intelligence Service training there. I was there for 3 years, 2 years for that and 1 extra, but you have somebody coming that you're going to pass the baton to from Chicago, Dr. Allison Arwady, who was our Chicago Department of Public Health lead. She was the health commissioner for the city of Chicago, took us through COVID, is absolutely beloved by the city of Chicago. And I'm thrilled that she will take the baton from you and run with it. So with that, I'll stop, but thank you all. And I'm going to introduce Dr. Annie Andrews, who will take over from here.
Thank you so much, Dr. Quinlan. It's a pleasure to be here. My name is Annie Andrews, and I'm a pediatrician, a gun violence prevention researcher, and a senior advisor at Everytown for Gun Safety. And I'm really grateful to be here today representing the Be Smart program. So thank you for that excellent segue about gun safety. It's a pleasure to be here among this coalition of leaders who truly understand the urgency and gravity with which we must work to protect our children and their communities. And the value of our coordination on this issue of violence and injury can't be overstated. As we all know, in 2023, gun violence remains the leading cause of death for children and teens in America. And as a pediatrician, like so many of you, I work with children and parents all the time. I know that discussions about gun safety and firearms in general can be emotional, and all of us come at this from different walks of life. Many of us are parents, some of us are gun owners, and some may not be, but we've all been impacted by gun violence one way or another. And I believe that all of us want to keep our kids and loved ones safe from harm. So National Injury Prevention Day gives us a unique opportunity to speak together with a unified voice and raise awareness about this gun violence epidemic and generate solutions that can save lives. We know that 4.6 million children in America live in homes with guns that are both loaded and unlocked. And I've been studying firearm injuries among youth for years now, and I believe what the data shows me, which is that secure gun storage directly addresses the risks that firearms pose to our children's lives. Secure storage practices include storing household guns unloaded, locked, and separate from ammunition. And we know that this is associated with reduced injuries and deaths related to child firearm suicide, unintentional shootings, and other acts of gun violence. And the Be Smart program is empowering our communities by educating adults and offering practical, accessible information and tools around secure firearm storage and changing the culture around this discussion. So we're really appreciative of all your support on National Injury Prevention Day and your continued work to keep our children safe. So you can go to besmartforkids.org to learn more about the Be Smart program and secure gun storage education. Thank you so much. And I'm going to pass it now to Bonnie from the American Academy of Pediatrics. She is the manager of the Council on Injury, Violence, and Poison Prevention. Thank you.
Thank you so much, Dr. Andrews. It is my distinct honor to introduce our next speaker, Dr. Ben Hoffman. I've had the pleasure of working with Dr. Hoffman for many years as witness to his steadfast dedication to kids and prevention of injury in kids. Dr. Hoffman was educated at the University of California at Berkeley and at Harvard Medical School, did his residency at Seattle Children's Hospital. And following this, he spent several years on the Navajo Nation with the Indian Health Service, where he worked with the community to develop a child passenger safety program, and also trained residents at the University of New Mexico to be good doctors and injury prevention advocates. Ben is a nationally recognized expert in child passenger safety and a leader in the field of community health and advocacy training for pediatric residents. He is a professor of pediatrics at Dornbecker Children's Hospital and Oregon Health and Science University, where he is also the vice chair for community health and advocacy, director of the Oregon Center for Children and Youth with Special Healthcare Needs, and medical director of the Tom Sargent Safety Center. And then in his free time, he has served as the director of the AAP Community Pediatrics Training Initiative and is also the immediate past chair of our Council on Injury, Violence, and Poison Prevention. And we are so excited that Dr. Hoffman is president-elect of the American Academy of Pediatrics and will assume the presidency as of January 1st, 2024. He never hesitates to speak up for kids, and today I'm so pleased that he's here to talk with us about elevating injury prevention at the national level. So I will pass it off to Dr. Hoffman.
Thanks, Bonnie. I'm really thrilled to be a part of this. I want to give a special shout out to anybody on the West Coast, because this started at 7 a.m., which was why my room was dark. The sun is now up, which is much better. I have been a member of Injury Free for 7 years, and I wish I had been part of it for longer. I want to go back to echo what Kyron said about Dr. Barlow and what an inspiration she has been to all of us, not just for her brilliant work in her community, but for her leadership, her friendship, and her kindness. And I am not kidding when I say that the Injury Free meeting is one of, if not the highlight of the year for me. We have the relationship with Injury Free has allowed our hospital program to grow. It's given us a community for not just me as a pediatrician, but for the staff who work with me, the incredible team that we've been able to put together. And it really has become a home for us in the way that the Academy, the American Academy of Pediatrics, has been a home for a lot of us in terms of fostering our injury prevention work. All of the names that we've heard today, from Dennis Durbin, Flora Winston, Kyron, so many people have found their tribe within the Academy. And I'm incredibly grateful for Bonnie and all of the hard work that she and the other staff at the Academy have done to elevate the role of injury prevention within the organization and help us advocate more effectively. I think, the policy that we are able to write guides so much of what happens across the country. And it's really been an honor to be a part of the team that includes so many people who are speaking today and who are out there listening. I want to thank Delaney and Injury Free for helping organize all of the activities on Injury Prevention Day. I think it's terrific that we're going to have hundreds of places lit up green, but I just want to do some level setting and remind us that lighting up a building green doesn't save kids. It builds awareness, and I think we need to take advantage of the awareness, building our brand, helping elevate the issues so that we truly can impact the burden of injury on kids and families and communities. The way that we do that is we go back to our core, which is data. We're really good at doing studies, at defining problems, at creating, at learning the truth through science. And with that science, if we're smart, we'll go out into the community to work with them. I think, one of the things I know as a physician is that as a pediatrician, I'm really good at strep throat. I know exactly what to do. We know exactly how to diagnose it. We know exactly how to treat it. We are experts in strep throat. We are not experts in communities. And I have seen many, many of us, including me, think we know the answer and go out to try to tell the community, here's what you need to do. So we need to make sure that we're working with our communities to ensure that their voice is heard and that we are providing education, resources, and working to change things at a systems and policy level that meet their needs. The most effective tool that we have, in addition to data and then the relationships and coalitions that we can build, which are absolutely essential, they're completely insufficient to be able to really move the needle, especially at the systems and policy level. And I think the most important thing we have in our toolbox to be able to address that are stories. And every one of us can tell stories about kids we've seen, about families we've worked with, about communities that we've impacted. But the most impactful stories are the ones that come from the community. So ensuring, that's another reason to ensure that that their voice is heard in this. I'm, again, incredibly grateful to Injury Free. I'm incredibly grateful to everybody who's joining us today. I want us to double down on a commitment to doing better. Kyron, we've heard about some of the statistics today, and even when you look at motor vehicle deaths, things have decreased. The number of child fatalities has decreased by about 50% over the last 20 years. But if you look at over the last 10, it's pretty much plateaued, which is what we're seeing with most unintentional injuries. And as we come out of the pandemic, facing a challenge that we didn't know existed, the old epidemics haven't gone away. We've still got button batteries out there. We've still got water beads out there. We've still got tons of firearms. Our work has never been more important. And I look forward to the future for the work that we're going to be able to do together in our communities, in our states, and at the federal level to truly impact the burden of injury on the kids for whom we care so much. So thank you so much for this opportunity. Thank you so much for everything that you do. I'll look forward to seeing a bunch of you at the beginning of December at the Injury Free meeting. And thank you, Delaney, for putting this all together.
Thank you, Dr. Hoffman. That was very inspiring, and it's true what you're saying. We need to take advantage of the awareness that's coming from this weekend and the work that we've done throughout the week, and make the impact so that we can change lives. And that's exactly what we intend to do and continue to do. So with that said, and with all the speakers and that have gone on, we would like to take questions and answer them. You can go on the chat on under Q&A to ask questions. While the questions are coming in, just want to let everyone know that the letter of support and the logos will be posted on the injury website, and also the press release. And see questions coming in. I guess we were very effective. Oh, there's a few there, Wendy.
I am not seeing the questions.
And Q&A?
Yeah, I don't see a Q&A. Oh, wait, I got it. All right, so from Elizabeth Price, is Injury Prevention Day November 18th every year? The answer is yes. If not, what day is it for 2024? It is always going to be on November 18th. Next question, will the slides be shared?
Yes. They will be
Yes.
shared on the website.
Put them on the website. This is a general question that says, what are ways you recommend to interact with communities and gauge their needs?
I'll take that.
Okay, go ahead.
I think you go out and meet them where they are. I mean, we see things, you know, in the healthcare sphere, we see things. And, you know, in the same way that Dr. Barlow identified a need through her work as a pediatric surgeon in Harlem, seeing kids who fell, you know, who were suffering injuries from falling out of windows and suffering injuries from playing in the streets. She went out to the communities and asked, how do we fix this? What do you see the problem? Where do you see the answers? And co-created solutions with them. And I think that's, you go out and you meet them. Everybody, they can't wait to meet you. I promise you that.
I would, if I could just add, I completely agree. And you can present what you're seeing, but then ask what they need and what their solution is so important to go out and listen and let them, you know, give them power and give them a voice, because they're not going to come, they don't come to public health. But we can go to them and say, how can we help, and listen honestly and openly to what they need.
This is one of the hardest parts of doing injury prevention, is getting into the communities. And you basically just have to go and start and talk and talk and talk and talk. And you have to, we here in Cincinnati, we started with playgrounds. We got the communities involved in building playgrounds. And this is what Dr. Barlow did as well. We got the communities involved in designing and building playgrounds. And when you are there, you have something that's tangible. And so that is something that shows that, hey, we're not necessarily going to leave. And that one of the hardest things with this is that you can go in and do something and then you run out of funding. But it's more important to try to be there with the community and keep doing things to show your presence. We go to community council meetings. We have a lot of communities here. Council meetings, there's recreation centers that we show up at. We've done a lot of things within the community. And one of the more important things is to find out you know, this is what we have for you, but we need to know what you need from us. So for example, you can say, hey, there's a lot of kids getting shot on this one corner, and the community will say, well, it's not that corner, it's that they have to now cross the street to go to a different corner. And so they're getting hit by cars now. So we don't know a lot of the things. And one of the things is it's very, very, very hard to get community trust. And once you just have to keep doing it. And once you get into the community, it's important that you keep doing what you're doing, so people don't think you just like drop and run. Anyone else on that one? All right, what is being done to spread awareness among communities who are disproportionately affected? Those who are primarily affected are often the least informed. How are those communities being addressed and being informed? So in my area here is we are going into the communities, we are talking, we have a hospital-wide group that is doing a lot of advocacy, and we are doing a big coordinated effort to go into underserved communities to make sure that people's voices are heard. And it's probably different in different areas, but it is hard. It is hard to get to the people that don't want to be heard or haven't been heard in the past. But you have to just keep going in, and you have to keep talking, and you have to keep listening.
I would also add that another really important tool for us in public health has been to find work with the partners who are in the community, because going into the community cold can be very, very difficult. But finding a partner who will bring you in has time and time again and really increased our reach and our ability to be effective. And that's why, you know, we fund a lot of, you know, community organizations, tribal organizations, because they are the trusted ones to help really build that trust, because we often come and there is an inherent distrust, and we have to overcome that.
Yes, we often partner with other people we don't want to duplicate efforts. So we partner with others who are doing similar work so that the community sees it from one group, but knows that we're also partnering with them. It's nice for, you know, our hospital to come and say, here, we're joining with efforts to help do things instead of the big bad hospital that's taking over our entire communities. Anyone else on that question?
I can add,
All
as an injury prevention coordinator for our hospital, as well as my other hats, I think that, like Dr. Posner said, teaming up with your community leaders and identifying who they are is very important. And then when you get to the table, don't just go in with your own agenda, because we do have the numbers and we do have the research that backs up the work that we're doing. We can always use that to support our claims of wellness and our claims for prevention. But a lot of the times the communities have completely different perspective of what's going on in their community. And we always have to be active listeners of what their issues and problems are. So we're there for injury prevention, and our communities are afraid of gun violence, and they want to know something. So we offer Stop the Bleed, we offer hands-only CPR, we offer things that are not normally primary injury prevention, because that's the way we can get to the table and they can listen to us as the way that we want to share our research and our program for them. So it's always a good advice to go in with an open mind and an open heart, and know that your realities are not the realities of the public that we serve. And it's important in injury prevention to make sure that we are able to accept the lives of the people that we work with, and then come in and share what we know, our truth and our stories.
Lenny, can I add to that? That's really important stuff you just said. I always feel like it's like we absolutely have to go into the community with humility. And I say that very honestly because what takes us so much work to gather the data from like EDs or our inpatients or whatever, finally geocode it, finally do some geographic information system analysis, and literally all this time later, with all the funding that we have, we finally get to see on a map the hot spots of the problem. We go out to the community to share this information with the people out in the community, and they knew it all along. The humility has to be quite honest. Like the grandmothers who live on that corner, they've known this and they can teach you all about it. And if you show up with that level of humility, they are happy to see you. They want to work with you because they may not have the weight of the voice that you can bring, and they may be some resources that you can bring. And as a team, you're unstoppable. It's just fantastic then.
Our last question is, many have commented on the power of research. I agree, yet many researchers aren't trained on how to effectively talk about their findings in the way the public and policymakers can hear. Any recommendations on how we can build our health communication skills? I can say from our standpoint, from my hospital, there are specific people that can help you with this. We have people in our media department that know specifically how to get things across. And there are other ways out there to be able to do that. People don't really want to hear statistics. They really want to hear personal stories more. So that's a way that we try to get more information across. Anyone else have any thoughts? Dr.
I would just, I think awareness that this is a problem is the first step, and just start talking to other audiences, talk to lawmakers, write op-eds, do media interviews, get the training that you need, but we have to get outside of our bubbles. And Wendy's exactly right that the way we talk to each other in a grand round setting is not the way you're going to compel action in the halls of Congress or in your state house. So recognizing that's an issue and finding a way to meet in the middle. We need to keep some of our data, but we have to bring in those stories and find a way to be more compelling, engaging speakers when we're speaking to those audiences.
Okay, and now one final word from Delaney.
Okay, so I just wanted to share, can you see my screen? Just wanted to share real quick. Some people had questions with regards to the website. This is the website for National Injury Prevention Day. You can definitely go in and see all the work that has been done previously and all the work that is being done at this moment. So I noticed a lot of people had to jump off. So I wanted to share that. It's Injury Free Coalition for Kids. I want to say thank you to our speakers, to our National Injury Prevention Day partners, and everybody who's taking part in National Injury Prevention Day. What we're doing is good. It's good work. It's good. It's a good thing, and it's good for our soul, our heart, and it's good for the public. And that's what we want. We want to keep people safe, and we want to keep people injury free. I will share now the video from last year's Shining a Green Light. Like Dr. Hoffman said, take advantage of this awareness and expand on the work that you're doing today. Visit us at 1 p.m. on Twitter, #BeInjuryFree, and join the conversation. Don't stop here. Continue it this year, next year, and throughout. And we'll see you on the 5th annual National Injury Prevention Day, which is going to be bigger and greater. And it's all thanks to everyone here today. Thanks again. I'm going to show the video now. Is it going?
Yeah.
There we go. And with that, and I, okay. And with that, I can say, go on and do the marvelous work that we're supposed to be doing. And thank you.
Thank you.
Thank you, everyone.